At the last ASH meeting, as I have mentioned, we were able to see the results of 3 different phase 3 prospective clinical trials. The design is not exactly the same in the 3 of them. So ZUMA-7 for axi, BELINDA for tisagenlecleucel, and then TRANSFORM for lisocabtagene. But in summary, these 3 prospective clinical trials compared face-to-face in patients with primary refractory disease or in patients with early relapse that in principle were transplant eligible, the standard of care, so chemoimmunotherapy plus consolidation with autologous stem cell transplantation versus the 3 different CAR T-cell products. 2 of these trials, the ZUMA-7 and the TRANSFORM, were positive. So basically, both of them demonstrated that the event-free survival for those patients that were treated with the CAR T-cell construct was significantly better than the standard of care. And the median follow-up was longer for the ZUMA-7. If we talk about overall survival, there were no significant differences in terms of overall survival between both arms, but still the follow-up is quite short, and probably we are seeing the beneficial impact of using cellular therapy as third-line treatment. The safety profile was also quite favorable to the experimental arm, and also the quality of life and patient-reported outcome measures. So probably just because of this data coming from these 2 prospective clinical trials, maybe in the near future, the standard of care for patients with diffuse large B-cell lymphoma, primary refractory or with early relapse, will change both in US and in Europe.